Welcome to the Sparked podcast, the show that will get you fired up about standards. On today's show, we have Danielle Tavares-Rixon, who's CSIRO's FHIR lead for Sparked, Cath Koetz, Director of Standards Adoption at the Australian Digital Health Agency, and Reuben Daniels, Board Director and Deputy FHIR Product Director at HL7 Australia and Enterprise Architect at Queensland Health. By the end of this episode, you'll have an under-the-hood insight into Sparked, and you'll walk away with a high-level overview of the products and processes involved in a community approach to standards. And you'll definitely be inspired to join the community after listening today. Let's get into it. I've got three terrific guests today. Danielle Tavares-Rixon, who's the FHIR lead for Sparked in CSIRO, the Australian eHealth Research Centre. She's a co-chair of the Australian FHIR Work Group and the Australian Core Technical Design Group. Reuben Daniels, who's a board member of HL7 Australia Standards Development Organisation and works as Deputy FHIR Product Director with HL7 International and as an Enterprise Architect with Queensland Health. And finally, I've got Cath Koetz here, Director of Standards Adoption at the Australian Digital Health Agency. Welcome, one and all. We're talking today about what makes up Sparked, what's in the Sparked Accelerator box, with a high-level overview of the products and processes involved in the community approach that it takes. I might start with you, Danielle. Tell us about what's involved in being part of the Sparked community.
The Sparked community comprises government, technology vendors, provider organisations. We have peak bodies involved, practitioners and domain experts, and we're all coming together to accelerate the creation and use of national FHIR standards in healthcare exchange. And there are three national FHIR standards projects that are currently underway in Sparked. The Sparked approach has been to adopt and adapt what was incredibly successful in the International FHIR Accelerator approach, as well as the earlier primary care data quality initiative that trialled out a clinical focus group and a technical focus group working in parallel. So that's the approach we've taken forwards. Now, for both those groups, there are regular meetings. The agendas are posted in advance so people can see if there's a particular topic they want to attend. These groups are where the design work happens. And they're also in the meetings where the decision-making happens. And anyone is free to join the calls and to vote on those decisions in the meetings, and also to come participate in spaces like chat.fhir.org, which is the community discussion forum, and also to submit requests for change to the standards. So I want to stress that an essential part of the standards development is feedback from the community. And without feedback, we can't know if these standards are appropriate or useful. And so we have the drafts of the current implementation guides are always available. And in fact, they're pretty up to date. And we encourage people to look through those and do a few things. We want people to read through it. We want people to test it out and then provide feedback. And we welcome that feedback from anyone and everyone. So you'll find at the bottom of each of the FHIR implementation guides in the footer, there's actually a little propose a change, which you can click on and provide feedback, whether that's something like suggesting a new feature or whether you think maybe we're being overly prescriptive. And in the FHIR space, there's the HL7 Australia ballot process in which we actively seek feedback on a proposed standard to ensure that the community that's going to be governed by it is in agreement with those expectations before it's published. But I want to stress that that can be any time. We want people to be bringing their experiences and their ideas, because the standards are only as good as the community building them. So in addition to the regular meetings, there are connecting and testing events. So HL7 Australia holds regular 2-day Connectathons around 3 to 4 times a year in different cities. And the overall aim of the Connectathon is to improve the quality of a FHIR specification by essentially implementing it and testing it out. So Spark runs targeted 1-day test events when a draft of a release is considered mostly complete to kind of change focus of activities from developing new areas into testing and maturity. And we'll run several of those in different cities to get people all in a room and kind of testing out different parts of the standard together.
Fantastic. Thanks, Danielle. Reuben, Danielle's really told us that the Spark community is where the rubber hits the road. You're an HL7 devotee. What does being part of the community mean to you?
Thanks, Brett. Well, first, thanks to Danielle for covering so much of this answer already. I guess I'm going to bring a different tack to the question. Fundamentally, being involved is, first of all, a fundamental belief in standardization and in particular in resolving the interoperability challenges we have as a nation. So if that's your belief, you believe that standards are the way forward, then what's involved in being part of that community, it follows that there's an unwavering commitment to open and consensus-based development of technical specifications, in this case based on the FHIR standard and other standards like SNOMED, CT, to improve interoperability of digital health solutions in Australia. Now, at this point, Spark is, as Danielle mentioned, pretty firmly focused on the development of these standards. But I think thinking about it strategically, what I'm hoping to see is that Spark provides a new foundation and a new way forward.
Terrific. Thanks, Reuben. The standard development process, you're up to your eyeballs in it. What's the value as you see it in the testing, in the balloting that's part and parcel of it?
I think the first thing to point out is that a standard is really only valuable insofar as it's adopted and that adoption achieves the outcomes that the standard was created to achieve. So really, from HL7's point of view, the standards development process needs to achieve or deliver 5 key things. First of all, we have to foster consensus, and that uses the processes Danielle alluded to earlier. We need to ensure that the content in the standard is fit for purpose, and I suppose that's what we're embarking on with the patient summary at the moment. We need to ensure that the standard is actually implementable, and one of the mechanisms of doing that are connectathons. It's also really critical to establish an appropriate community, and that to a large extent is what Spark is trying to achieve at the moment. And we also need to ensure the ongoing maintenance of the standard. So all of these things together are really what's involved in a standards development process such as the one HL7 is supporting at the moment. I think you asked about testing as well, Brett. The testing happens throughout the process. There are some formal elements to it, and really the goal ultimately is just to assess that the specification works in both test environments and real-world environments. So on the test environment, this is obviously any participant in Spark would probably have their own infrastructure or environments, but we also then provide the Connectathon events, which is an opportunity for implementers in particular to come together and test their implementations and ensure the interoperability goals of the specification are met in real software. And a form of real-world testing really occurs through publishing trial versions of the specifications for the actual community in the real world to start implementing and providing feedback. Testing is an ongoing endeavor, and the more we test, the better the standard becomes.
Terrific. And you mentioned connectathons. Danielle, I might go to you first. What's a typical connectathon involve? What is it maybe for some people who don't know? It's a very 2020s word as far as I know. And why do we love them so much?
We love them so much because they are a great space to be coming together in a safe environment and testing things out. What tends to happen in a connectathon is there are what we call tracks, which are streams for particular topics of interest. So Spark FHIR implementation guides will be there. So there will be an AU core track at the December Connectathon, which will also start looking at some basic patient test scenarios. What tends to happen in the day is, first thing to do is grab a coffee. Every kind of track will have one or more tables where you want to gather at. And the day starts off with some short words from the organisers, usually our HL7 Australia board member. And then you're either testing, connecting things, producing data, getting into discussions. Throughout the day, there's 1 or 2 breakouts, which are hot topics of special interest where people gather together and have discussions. If someone has made something really exciting, we might put that up on screen and walk through and bring everyone round to kind of have feedback or talk about what that looks like so that other people can try that out as well and see where that's available. And then towards the end of, I think, the second day, because they're 2-day events, is that we want to get together and understand all the different groups' achievements, because there's usually some really amazing things that are actually done during the connectathons. We close out usually the day with an address from a HL7 Australia board member. And besides that, there's also often some really nice food involved. But it's largely about the discussion, which I've got to say, is really, really good. I look forward to them.
Thanks, Danielle. Reuben, let's pretend you've had your 3 coffees already and you're at the Connectathon. What does it look like from your perspective? The vibrancy of the days seems to be really key. There's lots of live, ongoing interactions. Tell me about that vibe from where you stand.
Honestly, the best word I can use for it is magic. And it's quite hard to sometimes put into words because on the one hand, it's as Danielle and I mentioned earlier, it's developers coming together to verify that what's in the standard actually makes sense from an implementation perspective. But on the other hand, the first thing you realize when you actually arrive at a Connectathon and you see your tribe of standards developers and implementers around you, all with that fundamental belief in standardization, interoperability, and standardization, there is just such a strong feeling of community, a really strong feeling of we all pulling in the same direction. I've been going to Connectathons internationally in Australia since around 2014. And every time I show up at one, that magic and feeling you get is always there. It's really hard to describe. I was at one in Atlanta in September, which was actually held in a college football museum in Atlanta. And it was filled with well over 300 or 400 people, all working on the same thing. It's a highly positive environment. I don't think I've ever seen disagreements, not even heated debates. Everyone is there for the same reason. And that reason is healthcare, making the healthcare system better no matter where you are in the world and doing it through interoperability and the FHIR standard. It's a really great experience. Even if you're not a software developer, I encourage anyone listening to this podcast to consider showing up at one. You might find that this is the group you've been looking for your whole life. And you can get involved. And it's a really open, friendly, and approachable community of people who are always happy to have a conversation over a coffee or a beer. It's just really uplifting.
Fantastic. I think the closest I've come is an international Scrabble competition in the 90s, but it sounds very similar. So you might see me in December, who knows.
And now it's time for a fun fact from Kate.
Why does Sparked have 2 design groups? The clinical design group defines the workflow requirements, expectations, and the clinical data required to support it. This informs the technical design group, which takes these requirements and defines the technical specification to support them in the context of clinical workflow within an implemented digital ecosystem. There's 2 technical design groups, one for AU Core and one for e-requesting.
Cath, I'll turn to you. We've been talking
So
about...
once I stopped laughing at the international Scrabble competition,
I think I got most improved or something like that, but I'd never been in one before, so it wouldn't be hard to get that prize. Anyway,
nice.
Cath, you've been involved in global standards. Tell me about the benefit of them. What's this foundational piece?
Before I get to answering that question specifically, for me, similar to Reuben and Danielle, have been involved in this space for a really long time. It's interesting to reflect on how we've actually grown up and matured, I suppose, in our understanding of standards and their importance within the sector, and also our willingness to participate in things like the standards development process, whereas in the past that has been quite a removed process, I suppose, for a lot of people. It was hard to get involved at times. It was late night calls, traveling to places like Atlanta when trying to get out of there before a massive storm hits. But there was not really that opportunity at a local level unless you could get involved in something within Standards Australia. For us, with Sparked and the standards development sort of aspects, we've really had the opportunity to mature and get more people involved. And that's been a fantastic thing as we start to sort of move through into this, hopefully, into a really healthy adoption and implementation phase post the development process. But as far as the benefits, I guess working in this area for a long time, I'm still really shocked that we don't, as an industry, really understand what the benefits are. And perhaps that comes from that standards development process being historically less accessible. The creation of global standards really help to solve problems. And the interesting part of it at a global level, as we start off at that level, I guess, before talking about the localization aspect, is that bringing together of a whole lot of experts and stakeholders with diverse interests and experience and various other things, even government and others, into that space where we're actually sharing our brains trust to solve what can often be wicked problems. The benefit of us looking at global standards at an Australian level is that we do already have those foundations that we can utilise as we start to look at how we mature and connect our health system. So instead of actually having to start from scratch, which is what probably daunted a lot of us in the past, we can actually take things like what has been developed through the HL7 international process, developing FHIR IGs and core data sets and various other things, and bring those into the local environment to ensure that we're actually going to be able to quickly work out how we can connect our system together. The next aspect, and I know Reuben loves the idea of standardization, is to really look at how we not only develop and then choose which standards to adopt, but then also work out how to do that in a really consistent fashion, because that's where we get the most power out of implementing those standards.
The global to the local, you did mention localising. Why do we take different local approaches for core FHIR implementation guides? Why isn't there a single international patient summary around the world? Why do we do it differently?
It's a really good question, and it's probably one that a lot of people ask. But in the end, we know that there are a lot of variations between the way that our health systems operate in different parts of the world. So whilst we've got the fantastic international patient summary, and that in and of itself was an amazing achievement, bringing together the various different standards organisations and different governments to get consensus through a balloting process, like Reuben mentioned, to get to the point where we've actually got agreement on that. But as we look at our local health sector, we're not just talking about implementing it from an international perspective, we're also talking about how we can use it to connect systems and connect our states and territories. Each of the states and territories is very different in how it operates. The connection between the systems certainly is needed. So for us, taking the international and localising it into the AU patient summary is potentially going to be one of the most powerful vehicles for us to share data across our health system at a local level. I hope, though, and I'm sure that this will occur, that all of the work that's done at a local level will also feed back up into that international, because we still need to work out how we're sharing data across international borders as well as our local borders between states or between systems or between healthcare providers.
Do you agree, Reuben? Do you think that the work that we do locally has these ripple effects across the globe?
Absolutely. And I have seen that firsthand and been part of processes towards seeing that happen. I think the key part of what Cath is talking about there is there's this sort of virtuous cycle, especially when you're using good standards. Localization isn't a case of saying, well, the Australian patient summary is somehow different to the international patient summary. What it's saying is that the Australian patient summary is a specialization of the international patient summary, such that any instance of an Australian patient summary remains aligned and compatible with the international patient summary standard. So anyone that's able to process an international patient summary document will be able to process an Australian one. And localization is really the work that ensures that happens. These things tend to succeed a lot better when there is cross-pollination of ideas and people working on the localization remain very closely engaged with what's happening at the international level. And I'm pleased to say in relation to patient summary, Australians like Danielle have contributed to the recent ballot of the international patient summary, specifically to ensure that these things line up very well. So this ultimately is one of the great benefits of having a good global standard like FHIR, which doesn't make localization difficult. It doesn't make extensibility difficult. In fact, it embraces those things to a large extent, is what's made FHIR such a successful global standard.
And Danielle, you've seen this in progress. Are you confident that we're on a path for when the Australian tourist gets horribly sunburnt in Bali, that the international patient summary will be transferable to healthcare in Australia and there'll be that connectivity that everyone's seeking?
Yeah, 100%. I'm convinced from the work we've been doing over the last few years that I can actually see that now. I can see that work being done. with the community that's building, and the discussions really are the necessity of supporting Australia's particular needs, with their clinical, their regulatory, their population health, but within a global framework. It's become really, really clear that we will be going down that pathway of localising global standards in order to support our requirements and to be able to participate in that virtue cycle of reporting back in. And that's one of the things that I've seen more and more people do through the Sparked community over the last couple of years than I ever have. It's been pretty significant, the additional number of people who are saying, oh, yes, I can see that, and I really think this needs to work like this at a global level. And having the means to provide that feedback in, and it's being considered, it's being incorporated, even in the most recent work on things like international patient access, which is a companion standard to international patient summary. We're seeing that come through. So that's been really amazing. And the response from the global community has been incredibly embracing. And they are encouraging of us in Australia and everyone who is trying out this content and contributing to that refinement. That's what a global standard is. It's a good idea filter. You take a good idea, a set of good ideas, you stick them together and you start refining it. And the more you refine it, the more jurisdictions you try this out on, it becomes a global standard. And we're contributing to that.
Thank you. Cath, we're not about to wrap up and say job done and sit on our hands. What's the next hill we've got to climb here? Because the effort doesn't stop, right?
Absolutely. It's not even just a hill to climb. I think there's probably a mountain range ahead of us, if I'm honest with you. The standards development process is just the beginning. There's so much more that we need to do. The next is ensuring that we have agreement, I guess, around, what standards are going to be adopted. It's exciting through the Spark and HL7 process that we have consensus around the development of the standards. We also need to make sure that we've got a really clear understanding of what standards are being adopted according to what timeframe and those kinds of things. So that clarity around what is a national standard needs to be clear, so we have a pathway forward, and that way we can define a roadmap, implementation, look at exactly what we need to support the change process, support the implementers and all those sorts of things. It's exciting the level of maturity that we're seeing in the sector and the interest in adoption or in implementing within solutions. If we look back sort of 2 years ago, or even back to when FHIR was first created, the level of understanding of the value of standards is so much higher. We've got a lot of the solution developers and the healthcare providers, consumers and agencies of government, such as the one that I work for, all at the table saying that we need to make sure we have a solid plan, we know exactly where we're going, and we don't just stop necessarily at what we're developing at the moment either, because we're just hitting the tip of the iceberg. There's a lot of opportunity for us to continue the development process a long way into the future.
Thank you. And Reuben, what's the rest of the iceberg look like for you?
I've got to wholeheartedly agree with everything Cath just said, and specifically that we're really at square one of a really long journey ahead of us. We've got a fantastic start with this, and I do feel, given the participation within the community in the development of the standards in Spark, that we really have a good shot at taking things forward. What I'd like to see, and what I know is below the tip of the iceberg, is a much stronger commitment from all governments of Australia towards standardization and working back from there, and everything that sits from where we are on square one with the standards established towards setting policies on agreeing, first of all, as Cath said, what is a national standard, and then further how other governments and health systems in Australia take the standard forward within their own jurisdictions. This really is critical to the success of all of this working, and it's going to take a fair bit of effort, a fair bit of investment, but ultimately I believe it's absolutely worth it and an important investment in healthcare in Australia.
Danielle, what gets you excited about what's on the horizon?
I'm going to bring it back to a much smaller focus than my colleagues on the line here. R2. We've done a huge amount of work, and we're coming towards the end of that for AU Core, and that has turned out to be an incredibly amazing journey, and we're all looking ahead, and I am so excited to be looking at what's in that second release space, with the clinical design group, working through like the Australian for Data for Interoperability, that AU CDI-R2. There's a couple of really exciting kind of things there. And working on that in the AU for R2 is something that I'm really, really looking forward to get starting and trying to like kick off some new spaces where we can come to agreements on.
There you go. Round 2 for Danielle also. Thanks everyone for being here today. It was great to dive into the Sparked Accelerator Box and find out exactly what's involved. Really interesting conversation, and I hope it brings some enthusiasm about what's next, because it sounds really exciting.
The Sparked podcast is brought to you by the Australian Federal Department of Health and Aged Care, CSIRO's Australian eHealth Research Centre, HL7 Australia, and the Australian Digital Health Agency. You can join the community by heading to sparked.csiro.au. And don't forget to join us on LinkedIn at SparkedAU. This show is hosted by me, Brett Sutton, Director of Health and Biosecurity at CSIRO, and produced by Edge Studios' Janine Hamer and Lucy Ratz, and CSIRO's Dr. Naomi Stecklenburg. Sound by Hayley Dell.